to use Medicare if you have TRICARE. And this is for all the veterans out there that are always calling me, asking for information. I have a lot of information on my website, insuredmeds.com, for veterans. I'm making this video particularly for you to answer a lot of the questions that a lot of the veterans have asked me. Do you have Medicare or will soon be eligible to enroll? Do you need 4 parts of Medicare for TRICARE for Life? This video is going to give you the answer to all those questions. Do you have Medicare or will soon be eligible to enroll? Medicare has 4 parts: A, B, C, and D. It's important that you understand how each part differs and which parts you'll need for TRICARE for Life. TFL provides secondary coverage to Medicare, which is known as Medicare Wraparound Coverage. TFL is an individual entitlement. This means it's only available to military retirees and their eligible family members who qualify for Medicare. TRICARE enrollments for family members who aren't eligible for Medicare remain the same. Here's what you need to know about the 4 parts of Medicare. Medicare Part A is the hospital coverage part. You need Part A to have TFL coverage. Medicare Part A is hospital insurance funded through payroll taxes. It helps provide coverage for inpatient care in hospital, skilled nursing facility care, some home health care, and hospice care. InsuredMeds.com and Cena Health Corp is serving you as you have served us. If you are eligible at 65, most people become eligible for premium-free Medicare Part A at age 65 if they worked and paid Social Security taxes at least 10 years. If you aren't eligible for Part A based on your work history, you may be eligible based on your spouse's work history. What if you aren't eligible for premium-free Medicare Part A based on your own or your spouse's work history? Check out TRICARE Medicare Turning Age 65 brochure at tricare.mil/publications for instructions how to remain TRICARE eligible after you turn age 65. Some people become eligible for Medicare before age 65 based on a disability or a health condition. Some qualifying conditions include end-stage renal disease or Lou Gehrig's disease. Check out the TRICARE Medicare Under Age 65 brochure for instructions on how to remain TRICARE eligible when you become eligible for Medicare before age 65 at tricare.mil/publications. Remaining TRICARE eligible. If you're entitled to premium-free Medicare Part A, you must also have Medicare Part B to keep TRICARE. Regardless of your age or place of residence, exceptions for this rule are discussed in the Delay Medicare Part B enrollment section. Once you have both Medicare Part A and Part B, you automatically receive TRICARE benefits under TRICARE for Life. Medicare Part C, Medicare Advantage plans, and Part D prescription drug coverage isn't required. Keeping your information up to date in the Defense Enrollment Eligibility Reporting System, or DEERS, is key to ensuring effective, timely delivery of your TRICARE benefits. TFL is an individual entitlement. Coverage is only for the Medicare and TRICARE-eligible beneficiary. For example, this means your TFL coverage at age 65 doesn't extend to family members. Your spouse younger than age 65 will remain eligible for TRICARE Prime or TRICARE Select until they turn 65 and become eligible for Medicare Part A and B. How TRICARE works for life works with Medicare. TRICARE is different and separate from Medicare, and let's go into that. Part B Medicare. Medicare insurance. As you know, the Part A pays for the hospitalization and that type of thing. Part B is for your medical services. Part B medical insurance, you also need Part B to have TFL coverage. Medicare Part B is medical insurance funded through monthly premiums. It helps cover services from doctors and other healthcare providers, outpatient care, home health care, durable equipment like wheelchairs, walkers, and hospital beds, and preventive services, screening, vaccines, and yearly wellness visits. As outlined in the TRICARE Medicare Turning Age 65 brochure, the Medicare Part B premium is based on your income and is taken from your monthly Social Security, retirement, or disability payment. If you aren't receiving either of these payments, you receive a bill every 3 months for your premiums. Now, this applies also to people who don't want it to be taken out of the Social Security. You have to pay 3 months in advance. Both Medicare Part B, A, and B make up original care Medicare. If you're eligible for Part A, you must have Part B to have TFL coverage. This requirement doesn't apply to active duty family members or to individuals who've been enrolled in the U.S. Family Health Plan continuously since October 1, 2012. You should sign up for Part A Medicare and Part B when you first are eligible to avoid breaking your TRICARE coverage or having to pay a penalty, said Ann Brislin, TRICARE For Life Program Manager at the Defense Health Agency. If you sign up for Medicare Part B after your initial enrollment period, you may have to pay a late enrollment premium penalty for as long as you have Part B, and that means for life. The only way you won't have to pay the late enrollment penalty when you delay your enrollment in Part B is if you qualify for special enrollment period. The other two Medicare Part C and D are optional. You don't have to have them. But you are required under Medicare to have Part D or also have a penalty. Now let's go into what the Part C is. Part C is what's called Medicare Advantage. It combines Part A, Part B, and Part D, and it's called Part C. Why it's not called Part D? Because Part D is for the word drugs. Medicare Part C refers to Medicare Advantage plan. This is an optional coverage offered by private insurance companies that contract with Medicare. A Medicare Advantage plan must cover Medicare Part A and B services. These plans may offer you additional benefits not covered by Medicare or TRICARE, and about half of the Medicare Advantage plans include Medicare Part D drug coverage. Considering enrolling in a Medicare Advantage plan, you should be aware of the following. You may pay a monthly plan premium plus your Medicare Part B premium. You'll also have to pay co-payments at the time of service. This means you'll have to file a claim with TFL to be reimbursed for any co-pays. TRICARE can reimburse you for co-payments for TRICARE covered services. You must also get healthcare services from the Medicare Advantage Plan's network of providers with the exception of emergency services. So let's go over that again. Part C is what's called Medicare Advantage. It encompasses Part A, Part B, and Part D all in one package. Now, in some plans, there's no premium in the Medicare Advantage plan. And how this works is the government pays the private insurance company a certain amount every month to give you the benefits. And that's how some plans have no premium, some plans have $16 premium, some plans have a $40 premium, and many of the plans in Part C also include dental and various other benefits. Now let's go to Part D. Medicare Part D is the prescription drug coverage. Medicare Part D helps cover the cost of prescription drugs. However, you don't need Medicare Part D. TFL benefits remain eligible for the TRICARE pharmacy program. This means you still have the same pharmacy options to fill your covered prescriptions. Now, what this is saying is, if you have TRICARE, you don't necessarily have to have a Part D with a private insurance company, because you'll always be covered by TRICARE's prescription plan. So there are advantage plans that don't cover prescription. So the plan costs less money to you because you get your prescriptions filled by TRICARE. If you sign up for Medicare Part D, it's important to remember that Part D has a monthly premium which varies depending on which plan you choose. Medicare Part D coverage and costs can change each year, so it's important to review your options annually. If you get Medicare Part D, it would be the primary payer for your prescription medication, and the TRICARE pharmacy program would be the last payer for all TRICARE-covered prescription drugs. You have different options for your Medicare coverage, but remember, you only need Part A and B to have TFL coverage. You can learn more about TFL eligibility and the 4 parts of Medicare by checking out Becoming Medicare Eligible on the TRICARE website. Now, Part D medical drugs have different tiers and pricing. Tier 1 is generic prescription. Tier 2 is preferred brand. Tier 3 is non-preferred brand. And Tier 4 is specialty drugs. Now, when you have TRICARE, you don't have to use the prescription plan from Medicare. You use TRICARE's plan. So it's a big advantage to the people that want to keep their premiums as low as possible is by having TRICARE and Medicare together. Also remember that if you have TRICARE and Medicare together, you can go to any doctor that's in the Medicare program outside of the VA. So if you have a hard time getting into the VA, this allows you to get services near your home, emergency services, and everything else you need without having to go to the VA. Again, thanks for watching. Please share this with all the veterans and all the people you think this will be of service. Please subscribe, share, like, and comment. See you on the next video. My name is Bill Vargas. My company is Senior Health Corp. I'm an independent Medicare agent, meaning I work for you, not the insurance companies. I represent many companies to get you the best coverage for the lowest possible price. If you or someone you know is turning 65, please have them contact me by texting me at 845-380-5809. Thank you. Thanks for watching all the way to the end. Please like, comment, share, subscribe. And again, thanks for watching. We'll see you on the next video. Bye-bye.